Heart attacks risks have increased by 30% in the population group of 25 to 44 and has increased by 20% in the population group of 45 to 65. And blood clots are on the rise too. So we're going to be talking about how we can decrease your chances of getting blood clots.
You're watching the Dr. Jake podcast.
I'm Dr. Jake. I'm a naturopathic medical doctor and an integrative physician in Salt Lake City, Utah. On this channel, I share with you how you can heal your body down to the root causes and get your energy back without any harmful drugs or surgery. Be sure to subscribe more videos like this one. So let's begin. Blood clots are on the rise. Some people are blaming COVID-19. Some people are blaming the vaccine. Chances are that you've had one or both. So we're going to be talking about what we can do to actually decrease your blood clot risks. So like you just said, we're seeing that there's a 30% increased risk of getting clotting effects, like with heart disease, strokes, etc. I've definitely seen that in my population group. I'm seeing that people are getting clots more often than they've ever had before. And I don't think and we see that this definitely happened since 2020. What is the new thing? There's COVID-19. There's also these new COVID-19 vaccinations. It's not just a coincidence. There is something going on there that's causing these increased clots. Now, what's really concerning is we're seeing this happen much more often in superior athletes that are very young. And we're seeing blood clots happen like heart attacks, strokes, hearts just stopping, etc., from trauma that's happening from these blood clots and causing issues. So it's not just one thing. We can't say, oh, it's just COVID-19, it's just vaccination. It's a combination of the two. So what COVID-19 does to the body when you get it is it has a special spike protein on it. And this special spike protein causes damage to our microvasculature in our blood vessels. And this causes damage to that blood vessel, leading to the platelet aggregating there and leading to blood clot formation. But this same thing does happen in COVID-19 vaccination, because COVID-19 vaccinations make your body into a machine to make spike protein. So that does stimulate your immunological response to make antibodies to COVID-19, but also the spike protein is what is causing these blood clots. So COVID-19 itself naturally is going to cause blood clots, but also the vaccination is going to be causing these blood clots also. So we can't dive into, oh, it's COVID-19, oh, it's vaccination. It's a combination of the two. I'm seeing bad side effects from in both population groups, people that have gotten COVID-19 and have post-COVID syndrome. I've had people that have had the vaccination and haven't been better since. Now the question is if you've gotten vaccination, then you get COVID-19, are you going to have even a greater risk of platelet aggregation? There's some preliminary research that is showing that that is possible, but we don't have awesome research to say that's absolutely true. So the healthier you are, the less likely you are going to get blood clots. But just because you are really healthy and have a great exercise routine and eat great doesn't mean you're not going to do it. So the healthier you make your body is the better, because the older you are, the more comorbid conditions that you have, the more higher your blood pressure is, cardiovascular issues, diabetes, etc., is going to increase your risk in both groups. So in the COVID-19 group and also those that are getting vaccinated, that's going to increase because your blood clotting risk is already really increased with these medical conditions. So what we can do to, like, say, man, I'm really scared. I'm maybe an unhealthy individual. I have all these comorbid conditions, or maybe I'm an extremely healthy person, but I want to make sure that I don't get this blood clot, because I've been seeing all these really young people that you never would think would get a blood clot, and they've been getting it. I don't want that to happen to me when I'm exercising and just running out there and I just drop on the floor and I can't do anything about it. So what I'm doing for my patients, the best test that we are doing to, let's say you should be worrying about it and you should make a ton of lifestyle changes in your life, is we need to check a D-dimer. So that's just a simple blood test. You go into a doctor, you get your D-dimer checked. Many times you want to go to a doctor that actually knows what they're doing and knows that D-dimers do increase in both the COVID-19, people that have had COVID-19, and those that have had vaccinations. I would go to someone that actually understands that, or they're probably just going to be like, why are we ordering a D-dimer? And they won't really know how to interpret it appropriately. So you go get that D-dimer check. They will look at it and see if there is an increased risk of clotting with that one test. Now, if we do see there's an increased risk of clotting from the D-dimer, there are things that we definitely can do. Let's talk first about dietary things that we can do. We can start increasing a lot more garlic in our diet. It's a great blood thinner. Also, turmeric and ginger. These are all great blood thinners that you can eat, and you can eat a lot of these, and they're very healthy and they taste great, and that's going to thin your blood. Also, what you want to do is you want to make sure that you are very well hydrated. You want to make sure that you're drinking plenty of water. What I recommend to my patients is you want to get at least half your body weight in ounces of water. If you do that, you're making sure that you are well hydrated. Also, I like to check your red blood cell count to see how high that is. The higher your red blood cell count, the more potential you will have a clotting risk because your blood is thicker. So let's say you do have high red blood cell counts. It might be a good idea to get your blood drawn. Just give blood every 6 months or so, and that will decrease your red blood cell count and make your blood not as thick and viscous. So those are some basic lifestyle things that we can do. Now, if someone has a high D-dimer, I'm going to be doing more than just these dietary changes. I'm going to be giving them a lot of supplements to help with this. Usually I am going to be giving them a supplement of garlic that has a high amount of allicin and other constituents that are found in garlic that are going to really help decrease that clotting risk. I'm going to make sure they get a good quality fish oil that has an EPA of 900 and DHEA of 750, at least bare minimum. I'm usually going to give them high amounts of turmeric because many times they're just not getting it from their food sufficiently. And then if I see their D-dimer is pretty high and I'm really concerned about it, I'm going to be more aggressive and give them a supplement called nattokinase, which is a great supplement that we can take to decrease clotting. So that's kind of my typical protocol that I'm doing with patients that I see that there's an increased clotting risk on. So it's just looking at your clotting, your platelets, your ability of your body to clot. It's going to show that your body has increased propensity for clotting there. So that's what that test is checking.
Now, does that actually help you with seeing if you're at risk for heart attack as well? Or are there any types of scans that someone can take specifically to rule out heart attack risk?
So the D-dimer is going to be checking the clotting risk and your increase of heart attacks, strokes, or other clotting issues that can happen throughout the body. Now, there is other testing that you can do, like you could do an angiogram, which checks to see how narrow your blood vessels are. You do that of the heart. You could do this of your coronary arteries or other areas throughout your body. And that's just going to check how narrow your blood vessels are. And the more narrow they are, the more gunk that's hanging out in there, the more possibility there's going to be harm that happens from a clot. Because it all matters how big the clot is. Let's say a little baby clot breaks off and you have really narrow arteries, that's going to cause a heart attack or stroke. But and most likely that's what's happening, these little baby clots. It's not big clots that are happening. But D-dimer is going to check to see if you have a really increased risk of clotting. The angiogram is just going to see if you have narrowing of your arteries and your risk is even higher. Let's say you have the angiogram done, your arteries are really small, and then you also have a high D-dimer. We need to be much more aggressive at helping you out. We might go with some medications like Eliquis or something like that if that's the scenario. Yeah, it's a test that's covered by insurance. It's not a problem at all. Yeah, no issues at all. So like we were discussing before, we want to keep our blood vessels clear and clean. We don't want them to have all kinds of gunk in them. Plaques is what they're called in there. And that's usually caused by a lot of inflammation in the blood vessel, which I call is the stickiness of the blood vessel. And then you have the cholesterol that's circulating that sticks to it. Most important thing out of all is you need to make sure your inflammation is under control. So we need to decrease inflammatory foods. Most common inflammatory foods that we have are refined sugars. That is number one. And also poor quality saturated fats. So that's poor quality meats that are not done appropriately. For example, the meat isn't grass fed or the chicken isn't free range. The fatty acids are going to be completely different in these animals that are eating a different type of food than the animals that are just eating corn all the time. Those are the ones that are just conventionally raised that go to the factory and eat corn and fatten up. So we want to eat cleaner food. We need grass-fed meat and the chicken, and eat a lot of good quality fish. That's going to decrease our inflammatory state and then decrease our sugar intake. And then dairy in general is very inflammatory. because of the saturated fats in there. And then there's other constituents in there that are going to be inflammatory. And then wheat in general, because of all the glyphosates that are in there and all the sensitivities that we're seeing, is very pro-inflammatory too. So, and then you want to make sure you keep your blood sugar under control, and you don't want to eat tons of sugar all the time, eating tons of grains. You want to have a good balanced diet. You want to increase your vegetable intake, eat a decent amount of vegetables, and eat nuts and seeds and foods that are higher in protein and less in sugar. That's just a general understanding of a good, healthy diet to decrease inflammation and decrease the plaques that are going to form throughout your body. If you want to learn more about how to prevent blood clotting or how to prevent other chronic diseases, click my video to the right. I'm Dr. Jake, and I'll see you there.